My name is Jahnovia Wheatley. I'm from Westchester, New York. I go to the University of New Haven. During my junior and senior year, I took part in a program called the NYU STEP Scholars. And there I had the opportunity to work with medical students, doctors, and I also had a chance to be around Bellevue Hospital and also work in their simulation systems and their labs. And there I kind of realized how important it was for me to not only be able to provide for people through healthcare, but also be able to advocate through them. Being as when I did my research on Bellevue Hospital itself and I learned about the background and why they are a public hospital and what they stand for, it really inspired me to help people who need the help and also the people who can't advocate for the help that they do need and deserve. Hoping to specialize in emergency medicine. Keeps me motivated. Number one has to be my family. I have a really good support system at home. Everybody is just rooting for me through everything I do. Even when I slip up, they're still there. But also I'm motivated by my background. So being as I am an African American woman of color, I hope that once I am working in medicine, I can work to better the healthcare that we receive. During the pandemic in particular, I would say that I have been enlightened. So I've always, well, for the past couple of years, I've known that I wanted to be in healthcare and that I wanted to advocate for people. But during the pandemic in particular, I saw a lot of how healthcare workers were being treated and how their organizations and hospitals and companies were helping them. And I also noticed how people of color were being treated during the pandemic in particular. And I feel like that's where I kind of realized that there's so much more for me to know and so much more research for me to do. So I've been aligned throughout the whole situation to learn more and continue to learn more and stuff like that. A student in general, the transition overall has been vague. Like it's been very distracting just because of how quickly everything is going and also the idea of simply not knowing what's next. So not knowing when I'm going to be able to return to campus and live a normal college life and things like that. And it's also been difficult just to see how people are being affected. So how people are being affected in their communities and also how healthcare workers are being affected, just seeing how stressed they are and how sadly in some cases some hospitals and organizations aren't doing what they should be doing to support them. That's been a little bit discouraging, but it's also pushed me more to continue to advocate for better healthcare for all and also better support for healthcare providers. A lot of what I've been doing in most of my classes, well, most of my communication classes and my place classes, we've talked about a lot of advocacy. So advocacy on a large scale for many different communities. And as a future healthcare provider, I really want to be able to provide not only for, I mentioned in the article too, but not only for what a patient is consisted of based off of what their chart says, but also who a patient is based off of their cultural background, their community background, their family background, their economic background, and everything they are as a whole scale individual. And I believe that in doing so, I'll be able to really get to the systematic problems of healthcare and the systematic problems of what a person is going through as an individual. And just like one person at a time, in doing so, I'll be able to kind of combat the problems that communities on a whole scale face. So through advocacy and as a healthcare provider, if I continue to advocate and also provide, I'll be able to kind of focus on the greater good for individuals, especially being as I do come from a community of color and I am a woman of color. There's just a lot of challenges that both communities of color and women face in healthcare. So I feel like that it's important to tie my background into my future work. I would say that public health and advocating for people on a whole scale is not something that one individual can do. It's something that individuals who all have the same passion and the same hope can do together. And I feel like anyone simply by speaking up for another individual or somebody who can't speak up or advocate for themselves can help and create a change. And I also feel like it's important times like this to focus on not only our physical health, but also advocate for mental health on a whole scale as well, because a lot of times everything just comes back to my background. A lot of times minority communities and people of color don't realize the tie between mental health and also physical health, and that stems into other communities as well. So one, anybody can be an advocate for better health overall, and two, mental health and physical health tie into one another.